direction, the little one. Okay. So there's a few very positive things about the situation here, okay? And the Zenkers diverticulum is obviously a known issue when it comes to food catching in the throat and not smoothly going down to the esophagus, okay? All the way through the esophagus to the stomach, okay? It's a little pouch that is typically associated with regurgitation of food after you try to swallow it. It comes back up to the throat because that little pouch is sort of holding the food and preventing it from going down to the stomach. This is a bird's eye view of your throat. We've got the front here, and then the back. So here's your right side, left side. This is your tongue here, the epiglottis, a normal part of your swallowing mechanism, and then your right vocal cord and your left vocal cord. This is your airway, your trachea. So when you talk about aspiration, you're talking about things going into the airway, as opposed to things going down the correct way, which is the esophagus, which is behind. The opening to the esophagus is behind here. One of the most important things that we're looking at when it comes to the risk of aspiration is how much sort of pooling of secretions and or food is there in the throat at any given moment. You see these pockets on the side here? This is a pocket on your left and a pocket on your right. Those are called the piriform sinuses, and that's where food goes down into the pockets and then down the center to the esophagus. When people have seriously significant Zenkers that make them at risk for aspiration and aspiration pneumonia, what you often see is big pooling in these areas here, like saliva and food debris and other things like that, that are basically stopped from going into the esophagus. You know, they're like hanging out right at the level of the vocal cords, and you can imagine how they can spill over and then go down the airway. Mm-hmm. One thing that's very positive about your swallowing mechanism right now is that you don't have a lot of pooling of secretions there, meaning that even though you are regurgitating things, you have enough strength to at least push them down into the esophagus. Maybe they come back up, but then you can push them down. Come back up, push them down. And eventually you are able to clear things away, and there's no secretions or saliva or food that is trying to spill over into the voice box area right now. Now, when you cough, we could actually see a little bit of that stuff coming up. So yes, there's no doubt that you are having some regurgitation, the classic symptoms of a Zenkers, but the corresponding muscle strength of your throat is strong enough to push it down and to get it away from the vocal cords. In addition to that, we can see that your vocal cords have good mobility and good anatomy, so they're able to close and protect against things from going down. So that's another positive about your situation, that you've got some good swallowing strength to squeeze things down the right way, and your vocal cords are intact in terms of their, ability to close to protect your airway. That's obviously relevant for the voice and for aphasia, right? That your vocal cords are working well, which means that there's a positive sort of prognosis, let's say, in terms of your speech and getting things back from at least a vocal cord point of view. Obviously, as you recover from a stroke, your vocal cords are capable of producing sound, and they're capable of closing. See this here? Mm-hmm. How they open and close like that?
Yep.
So we've got very good anatomy. All the stuff is cleared away. There's no food debris. There's no secretions, and your vocal cords close. So thinking about your situation and about whether or not it makes any sense to try to do a surgical intervention on the Zenkers, okay? And that's really the only kind of option there is, I would say. There's no real therapy or medicine or other things like that you can take for Zenkers. The things that push us towards surgery for Zenkers as opposed to diet modification, right? Just managing it, thickening the liquids, coughing after you eat to make sure things aren't going down the wrong way, eating slowly, small bites, things like that, is aspiration pneumonia, so that you're actually getting aspiration, or a lot of secretions and food debris that we see spilling over into the vocal cord area, or vocal cords that aren't able to function normally and clear things away. So in your situation, you've got a lot of things going for you in a positive direction. You're not losing weight, you haven't had pneumonia, You're clearing things away very nicely, okay? And you've got intact vocal cords that can cough and clear things away if they start to go down the wrong way. The risk of surgery when it comes to doing a revision surgery for a Zenkers is not insubstantial, right? The risk of any Zenker surgery is a leak of the esophagus, which can cause very bad infections in the chest and in the heart area. And the risk is even higher if it's a revision surgery. So I would say that, everything about your situation is tilting me away from recommending a revision surgery. I think it would be quite dangerous for you, and it could not necessarily offer that much improvement in a functional status from what you're doing right now, because you are actually getting things cleared away. So it's hard for me to recommend a revision surgery with everything you're recovering from, a stroke and from the overall health situation. But you're doing all the right things in terms of watching the diet, thickening the liquid, being careful about eating. Don't lay flat after you eat, because think about the regurgitation, how much easier it is to cough something away from your throat if you're sitting upright. It's a lot easier than if you're laying flat. So, just making sure that you don't eat before you lay down and, things like that. These are all the common sense things that I know you're already doing.